My name is Michael Woodard. I'm a family nurse practitioner student at Georgia Southwestern State University. This is my complete physical exam. Our patient, Mr. Burnham. To start with, we'll assess the skin, note for color, looking for paleness, diaphoresis, none of which is present. His skin is pink. There's no cyanosis noted. We'll look for turgor. There's no tinning. He has good skin turgor, well hydrated. We'll check for lesions. Patient doesn't complain of any lesions, but we'll do a visual inspection anyway. And lift your shirt for me, sir. There's no lesions anteriorly. Or posteriorly. No suspicious moles or anything. No lesions on the legs. Next we'll go to hair. No pattern baldness. Hair is brown in color. It's distributed evenly over his body. Check his nails. Nails are well manicured, are clean, no clubbing. Nail beds are pink, no cyanosis noted. Head's round. We'll palpate for any tenderness over your scalp, sir. We'll check his face for symmetry and symmetrical. And now we'll palpate his TMJ joint. Any tenderness when I'm at, let me get you to open your mouth for me. Open wide as you can. Close. Open. Close. Any pain then? There's no pain, there's no click, there's no crepitus, so he has a negative exam for that. Palpate his temporal artery. And his temporal artery was palpated on both sides and equal. Next we'll move on to the eye exam. His lids are symmetrical, no edema, no redness, no swelling. I'm going to dim the light and check his corneal reflex. Get you to look straight at my nose, sir. And the corneal light reflex is positive in both eyes. And while the light's off, I'm going to check his red light reflex. Just there, straight to the wall, sir. Red light reflex is positive in his right eye, as well as his left eye. Now we're going to perform a couple of tests. I'm going to do the confrontation test to check his peripheral vision. I want you to let me know when you can see my fingers, okay? Now. Okay. I want you to point to which fingers are moving, okay? Alright. His test is positive. If the test was negative, I would cover up my right eye, he would cover his left, and we would do the test to see when both of us saw the fingers, to measure that as well. Next we're going to do the 6 cardinal positions of gaze test. I want you only moving your eyes in this pen, okay? Both eyes move together and symmetrically with no problems. And on that test, you want them to take their eyes as far as they'll go. Next, we're gonna do the cover, uncover test. So what I'm gonna ask you to do, Mr. Burnham, is cover up your left eye. I want you to look at my nose when you do it. Let's uncover it. All right, cover it again. All right, uncover. Now do the opposite eye and uncover. What I'm looking for in that test is to see if there's any movement of the uncovered eye while he's covering it, and that's looking for endo and exotropia. These eye tests that we've done also checks for cranial nerves 3, 4, and 6. While we're doing the eyes, I'm going to do cranial nerve 2 test and ask Mr. Burnham to read that right there for me.
Type on group.
And cranial nerve 2 is intact. When I checked his corneal light reflex, I also checked his pupils, and they responded to light. They constricted, both of them, so his eyes were pearly. His pupils were equal, round, reactive to light, and accommodation. Now I'm going to check his sclera. Sclera is white, no jaundice, no nodules noted. So based on my exam, it's a normal eye exam. Next, we'll move on to the ears. First, we'll check the outer aspect of his ears. There's no edema, no redness. We'll palpate any tenderness. His ears are symmetrical. Do the same thing on this side. No redness or edema, palpation, and tenderness. No tenderness noted. Next, we'll check his inner ear. His tympanic membrane's intact in that ear. No earwax noted. And his tympanic membrane's intact in that ear as well. Next, we'll move on to the whisper test. I'm going to rub my fingers together. I'm going to start close to your ear and I'm going to move them away. So let me know when you can no longer hear them, okay? Okay. And the other side. Now you can see it's about equal distance apart, so it did well with that test as well. That also checked cranial nerve 8. Next, we're going to move on to the nose. We'll check the patency of his nostril. I'm going to take your head back, please, sir. Nostrils are patent. There is a mild edema and redness to his left nair, as he does have a little sinus problem right now. The turbinates, like I said, was a little inflamed and a little red. The septum was midline, no deviation. I have 2 cotton balls that I've sprayed, one with lemon and one with orange, and we're going to ask him to smell and tell me which one is which.
Lemon. Orange.
And that's correct. And that checks cranial nerve number 1, olfactory cranial nerve. Next, we're going to move on to his mouth exam. So I'm going to get you to show me your teeth. All right, very good. And open your mouth. Say ah. His tonsils are fine. All his teeth are intact. You can put your teeth together like that. Gums are fine. They're pink. Moist mucous membranes. No bleeding. His uvula. I'm gonna get you to. His uvula was midline. I'm gonna get you to stick out your tongue and move it side to side. All right. Can you puff out your cheeks for me? Smile real big. All those tests are normal. Checking cranial nerve 7 for the smile and puffing out his cheeks. and sticking out his tongue and moving it side to side. Examine cranial nerve 12. Next, we're going to move on to the neck exam. So I'm going to palpate for masses. No masses are present. Trachea position is midline. No deviation. Get you to look up as far as you can. Look down as far as you can. Take your ear to your left shoulder and your other ear to your other shoulder. Any pain or anything when you do that? Full range of motion. No problems there. I want you to shrug your shoulders for me. Alright, now push this way with me. Alright, I'll push the other way. So no problems with that. Checking cranial nerve 11. I'm going to check your thyroid, okay? I'm going to feel for any masses or nodules or lesions. Can you swallow for me? Okay. No masses, nodules, or lesions are present with the thyroid. Swallowing also check cranial nerve 10. Can you tell me your name?
Blake.
Speaking also checks cranial nerve 10. Now I'm going to move on to inspect his lymph nodes. Feel for any swelling. No lymph nodes present there. Nor any present there. In lymph nodes, we're looking for lymph nodes that's able to move around. If it's hard and unable to move around, you worry more about malignancy. Next, we're going to move on to inspecting his lungs. His posture, he's not tripoding. He's sitting relaxed. He's not having any respiratory distress. There's not much effort with his breathing. I'm going to check his respirations. Respirations are 16, which is within the normal limit. There's no barrel chest. I'm going to examine the posterior chest for symmetry and breath sounds, and I'll also check CVA tension. I'm going to pull up your shirt, sir. And take a deep breath. There's normal symmetry, no problem. Taking a deep breath. Deep breath for me. Again. Again. And one more time. I'm going to do the other side. Deep breath. Okay. Again. And again. All right. Lung sounds are clear, no rails, wheezing, or rock out. I'm checking for CVA tenderness. Let me know if you feel any tenderness on this percussion here, okay? Any tenderness? Tenderness? No CVA tenderness, so we move around to the anterior chest and do the same thing. Pull up the shirt a little bit. Take a deep breath for me. Alright, it's symmetrical. No problems there. Check his breath sounds again. Deep breath. Again. Again. All right. Same there. No bronchi rails or wheezing. We're going to check his pulse. I've already checked his temporal pulse, and now we'll move on to his carotid pulse. And obviously you don't want to do this at the same time. I'm also gonna listen to his carotid to check for any bruise. Get there, hold your breath for me for just 1 second. All right, you can breathe. And check the other side. All right. No bruise noted. We're gonna check your brachial artery here. Okay. Move down to your radial. Okay. And check your ulnar. All right, on the other side. Okay. All right, I'm gonna get you to lay back with your head this way so I can check your popliteal artery. And doing this exam, you may have to lift their leg up. You never want them to lift their leg, but you may have to lift their leg up to palpate popliteal dorsalis pedis. And also, I know you're supposed to check the femoral artery, which will be right here and right here, but we're going to defer this for this exam because he had a positive popliteal and a positive dorsalis pedis, so it's known that he has a femoral pulse as well. So I'm going to get you to sit back up for me. Now I'm going to check for the point of maximum impulse, or the PMI, which you check with the palm of your hand. It's the fourth intercostal space, mid-clavicular line, and just listen, feel for the left ventricle contraction. Now we'll move on to the abdomen. So I'm going to ask Mr. Burnham to lay back down for me. Raise your shirt, sir. So first you do a visual inspection, check color, no bruising, normal male hair pattern, check for pulsations, no pulsations noted. So first you'll move on to auscultation. Vital sounds are present in all four quadrants. No arterial or venous sounds heard. I'm going to go to light palpation. Any tenderness when I press. So no tenderness on light palpation. We'll go to percussion next. With percussion, you should be listening for dullness over organs and tympany over the intestines where the gas is. Now we'll move on to deep palpation. With deep palpation, you press a little harder with two hands for any tenderness or masses. And he has no masses. Any tenderness? No tenderness. The CVA tenderness was done when I was doing his back exam to keep him from getting up and down so much. Next, we're going to try to palpate his liver. So I'm going to use a hook method. Your fingers underneath his ribs here. Take a deep breath in. Blow it out. And I didn't palpate his liver, so it's not enlarged. But if you do feel it, it'll be on the pads of your fingers there. Next, we'll try to palpate his spleen. So you lift up with the back and right under his ribs. Press in, deep breath in. Blow it out. I didn't feel his spleen, and in normal adults, only like 5% of people can palpate the spleen. We'll also try to do the same thing with the kidney, and it's basically the same test, just opposite. Deep breath in and blow it out. And I didn't feel his kidney either. Now we're going to move on to the musculoskeletal exam. You can sit up, sir. We're going to ask him to stand up. I'm going to visualize his spine while he's standing. It's straight, no curvatures. I can get you to take 2 steps forward and then turn around and walk back. Normal gait, no problems there, and that also is checking cranial nerve 9. Muscle size, back wise, symmetrical. He's a well-developed male. And we're going to check his joints. You can have a seat back. Check his joints for range of motion. You can do passive range of motion as well as active range of motion. Any pain on that? Any pain there? Alright. On your shoulder? No pain there. Alright. How about this? Any pain here? Pain there? Alright. No pain. I'm going to get you to turn around. Put your feet. You can sit up and lay down, whichever one more comfortable for you. Check his ankles. Right. Pain there. Any pain there? Alright, get you to bend your knees for me. Any pain there? Other knee. Pull your knee up to your chest. Checking his hips, range of motion. Pain. Alright, no pain. Alright, very good. You can sit up. Alright, next we're going to move on to peripheral nerves for sensation with light touch. I have a cotton swab we'll test him with. I need you to close your eyes and tell me which hand you feel me touching, okay? Palms down, please.
Left. Left. Right.
Alright, we'll do the same thing on his feet.
Right. Left.
So that's intact. I'm going to do the reflex test. I'm going to test his triceps. Well, biceps, palm down. Thank you. Check the radial, or break a radial. Patellar. Okay. Alright, I'll get you to lay back down one more time for me, sir. And I'll check your events for your leg. It'd be nice to have a reflex hammer, but I don't have one, so we're just going to use an end of a cotton swab. You want to start on the lateral aspect of his foot and curve in just before the toes. The toes should not fan up. If they fan up in an adult, it's an indication of a central nervous system injury. So that was a negative test. And that was a negative test. All right, sir, sit up one more time. We're gonna do the rapid alternating movements test. I want you to tap your legs and do your hands up just like this. All right, very good. And do your fingers together. Alternating. All right, very good. No problems there. 2 more tests and we'll be done. Excuse me. We're gonna do the Romberg test. I'm gonna get you to stand up. Put your feet together, arms out, palms up, and close your eyes. You do this for 30 to 60 seconds to test for any sway. All right, very good. You can open your eyes. Hold your arms up for one. Hold your arms up again. There you go. And we'll do this for 30 seconds with the eyes open to test for sway. Okay, no swaying. I want you to take 2 or 3 steps, heel to toe, straight ahead, please, sir, and then come back. All right, that's it. That tested his cerebellar function. And this concludes my complete physical exam.